Welcome to the ABCs of kidney disease. I'm Daphne Knicely, and today I'm going to talk to you about the causes and stages of chronic kidney disease. This video is a part of the Johns Hopkins Nephrology Patient Education Program, and we like to thank our sponsors, the Ed Krause Endowment and the Shaw Foundation. So chronic kidney disease is a silent problem in the United States. There are 30 million people in the United States alone that have kidney disease. That's about 1 in 7 people. And the crazy fact about this is 97% of them have absolutely no idea they have kidney disease. That's because most of the time kidney disease is silent. There's no symptoms until you've basically lost 90% of your kidney function and you're getting close to needing dialysis. Now, a lot of people are at risk for kidney disease. 1 in 3 patients with diabetes is at risk. 1 in 5 with high blood pressure is at risk. Also, those that are over the age of 60, that are obese, have cardiovascular disease, or certain ethnic groups are at risk for kidney disease. So how do we screen or diagnose for kidney disease? Well, there are 2 tests that I use. So one is a urine test. It's a urine analysis or urine dipstick, and really what I'm looking for is blood or protein in the urine. You should not have blood or protein in your urine. They're actually really big molecules. So the example I like to use is like pasta falling through a strainer. Shouldn't happen. Or for the kidney, it tells me that there's damage to the kidney's filter that's allowing protein or blood to fall in the urine, which should not happen. And sometimes people will have this as their first sign of kidney disease before they have any chemistry changes. The next test I use is a blood creatinine test. So creatinine comes from muscle. It's just a normal waste product, but you only get rid of it through your kidneys. So when it goes up in the blood, I know the kidneys aren't working perfectly. But it's not a perfect test. If I have a 90-year-old woman that maybe weighs like 90 pounds, and I have a big bodybuilder, 20-year-old, who weighs like 300 pounds of solid muscle, they have different muscle amounts. And so they're generating creatinine at a different rate. But maybe they both have a creatinine in their blood test of 1, which is normal. But what it tells me is that bodybuilder is working overtime to get rid of creatinine. His kidneys are perfect. Whereas that 90-year-old woman, her kidneys might not be working as perfect as they used to, because really she has no muscle mass and her creatinine probably should be like 0.5. But instead of me guessing this, we have something called a glomerular filtration rate. And it's really a calculation where we take into account your age, your race, your gender, and your creatinine level. And so what happens is if your creatinine goes up in the blood, I think your kidneys aren't working great. Well, the glomerular filtration rate works the opposite way. It decreases when your kidneys aren't working great. So they move in opposite directions. So what really is this glomerular filtration rate? Well, it's literally a measure of how many milliliters per minute of blood your kidney's filtering. But for me, it tells me how much function of your kidney that you have. So normal is about 90 to 100, and it decreases as the kidney ages over time and as the kidney disease gets worse. And I use this glomerular filtration rate to stage kidney disease. So what are the stages of kidney disease? So there are 5. And the first stage is when that glomerular filtration rate is more than 90. But maybe I know that there's damage to the kidney. Maybe I have a kidney biopsy. Maybe I have blood or protein in the urine. Then stage 2 is from 60 to 90. Stage 3 is from 30 to 60. Stage 4 is from 15 to 30, and stage 5 is less than 15. Usually as a kidney doctor, I don't start seeing patients till around stage 3, 4, or 5. And most of the time, if somebody's in stage 4, that's when I start the discussion with them about, well, in the future, if your kidneys got worse, are you thinking about dialysis or transplant? And I talk to them about the options. We don't start at them, but we start talking about it. And then in stage 5, really, it's not until that glomerular filtration rate is about 5 to 10 before people start to develop symptoms of kidney disease. And that's when they usually need to start dialysis. So I use the stages of kidney disease a lot as a kidney doctor. 1, it tells me how well your kidney disease is, if it's progressing or not. And 2, it tells me how often I need to get labs and how often I need to see you in clinic. Because somebody in stage 2 compared to stage 4, I'm not going to see someone in stage 2 that often. Maybe once or twice a year, whereas somebody in stage 4, I might see every 3 months or every 2 months. It depends on how their kidney function is trending. There are a lot of different causes for chronic kidney disease, but the number one in the United States and in any developed country is diabetes. Diabetes can affect any organ in the body, and it's known to affect the kidneys if it's not controlled. High blood pressure is the #2 cause for chronic kidney disease in the U.S. And then after that, it's kind of a mixture of things. So there's a category called glomerular nephritides or glomerular nephritis. And really this is a group of diseases where your body's attacking your kidneys. You're making some sort of antibody, maybe due to things like lupus or something else, or you have a disease specific to your kidney like IgA nephropathy or membranous nephropathy. Some other causes, there's inherited diseases. So a good example of this would be like polycystic kidney disease, where your entire kidney gets replaced by cyst. Then we have some other diseases, so like urinary tract obstructions. So most common is for men having prostate problems. Well, like I explained in one of our other videos, is going from your bladder out of the body is your urethra, and for men that goes through your prostate. So if your prostate enlarges, it basically pinches off that tube and you can't get rid of urine. Well, that backs up to the kidneys and causes damage. For women, this could be uterine fibroids that can cause obstruction or blockage. Also, repeated kidney infections can cause damage to the kidney. So if I have an actual infection of my kidney, that can cause scarring over time. And then sometimes we have medications. So every medication has side effects, and sometimes medications are necessary, but sometimes those medications can cause damage to our kidneys. If you're interested in learning more about chronic kidney disease, causes and stages, then check out our resources. Also, if you want to know about normal kidney function, the complications of kidney disease, or treatment of kidney failure, check out our other videos.